Good afternoon. I have to report COVID-19 continues to rage across our state. Today we've had more than 2,000 new cases reported today. As you know, our nation has suffered over 250,000 deaths due to COVID-19 during this pandemic. We are in a very difficult situation, and we are acting to save people's lives in the state of Washington. But we also need to act to help people whose economic prospects have been damaged by this pandemic. So we are acting today in a significant way to help our business community in the difficult days they have responding to the pandemic and some of the restrictions that have been necessary to save lives in the state of Washington. I'm glad we're being able to make these announcements today because we need to take action on all fronts, including helping folks, employees whose jobs may be lost and businesses who will have tough days ahead. On Sunday, we had announced a $50 million package of business supports, but after discussion with legislators and agencies and other folks in the public, we have now announced that we will double that and more than double that in our announcement today. So today we are announcing a package of $135 million in economic support for Washington businesses as well as Washington families. This will include $70 million in grants to businesses to help them out. And I will provide our Department of Commerce with funds so that they can provide grants to the applicants in their Equity Business Grant Program and also expand the Business Resiliency Program. And as was announced Sunday, $30 million will be available to establish a recovery loan program. This new package also includes $20 million for rental assistance, which will cover residential tenants' debts, but which will obviously also help landlords who otherwise may not be able to recover rental payments. This program will also provide $15 million for energy assistance for low-income folks to make sure they can pay their energy bills during this difficult winter. I've spoken to a number of legislators about this. I want to thank their efforts. I believe that there's broad support in this direction. We know we're not done. There's more things I'll talk about today, and other ideas will be put forward. So again, thanks to the legislators and their efforts as well. And today I'm joined by Commerce Director Lisa Brown, who will provide a lot more detail about these economic supports. Director Brown.
Thank you, Governor, and I'm really pleased that you and the legislature have decided to significantly increase the amount of grant funding that will be very soon available to businesses. And we know that the uncertainty and the hardship that's been caused by the pandemic and the public health measures have put thousands of business owners and their employees in very challenging times, probably the most challenging times of our lives. I have some slides here from our economic recovery dashboard. And as you will see with the first one, we took a very deep dive, as did the rest of the country and frankly the globe, early in the spring. And we have been moving back from that very low point ever since. And our economic recovery dashboard is designed to look at how employment and business income and our trade activity and other key economic measures are faring as we move forward, hopefully rounding the corner with the virus and into recovery. You can see how we compare to other states here. We still have a ways to go to get back to where we were. And what we're announcing today is to help out those businesses most dramatically affected by the most recent measures. If you go to the next slide, you'll see that the impacts do vary widely. They vary county to county, which you can see on our dashboard, but they also vary sector to sector. And there at the very biggest impact is leisure and hospitality. So we will be focusing this round of new grants on those businesses most hard hit, both by the current restrictions and also those like music venues who've been closed down and negatively affected all along. So thank you for that. I want to say that I really appreciate how much chambers, business associations, Main Street groups, and others have been pulling together over the last several months and giving us feedback on these conversations. With earlier CARES funds that we've already received, we've run $50 million in grant programs for businesses, for nonprofits, and arts organizations. And at the same time, CARES Act funds have gone directly to local governments around the state. And some of those local governments are also running some business assistance programs. So we encourage businesses to check with their counties to see if there are still resources available there as well. But now, with your announcement and the work that you and the legislature have approved, we will be able to have $70 million in new grant funding. $50 million will be focused, as we said, on the business and sectors hardest hit. And we are going to work as quickly as possible to get a portal open for applications to come in for those grants. And we'll be posting that information on the Commerce website within the next week, as soon as we can get it done. The rest provides funding for other businesses who have applied for our earlier business grant rounds who have not been funded yet, and for our Business Resiliency Network. As you mentioned, we're also setting up a recovery loan fund, $30 million. This $30 million will be leveraged with private capital, and it's based on the experiences of other states. We think that we may have as much as $100 million ultimately available for loans before the end of the winter. And that will be an important bridge for businesses who have had traditionally a hard time accessing traditional financing. I just want to mention again how we're prioritizing these funds. Some businesses have been harder hit than others. This new round of grants will be focused on those such as full service restaurants, fitness centers, and those that have had the biggest cumulative impacts. And second, equity is always a top priority, and we're committed to making sure that we help businesses in rural communities, in the hardest hit industries, and those entrepreneurs and small businesses who historically have faced disadvantages and less access to resources. Economic recovery is a long game, and so while these grants provide immediate support, the loan program will help support medium and long-term recovery efforts. And I just, again, want to thank you, Governor, and legislative leaders for understanding that if we can get these dollars out the door as soon as possible, they will recirculate in our local economies. And I want to encourage everyone to think about your small and independent businesses, very innovative ways in which they are pivoting to serve you. And those dollars, as I said, recirculate in our economy. So please support those small, local, and independent businesses. Thank you, Governor.
Thank you, Lisa, for your leadership. We know your team's going to be working really hard to get these grants out there as soon as possible, and you've done that already. Thanks for your quick action. This is a significant relief effort. We can't say it's going to help every single business in the state of Washington, but we can say we're not done with this, and we're happy we made real progress today. But obviously there are other things we can do to help these businesses that are having difficulties, and so we want to be creative and looking for other opportunities, and we are going to find some and have found some. We've been working with the business community, legislators, and our employment and security, unemployment insurance tax relief. Because of the unemployment we've suffered due to the COVID pandemic, under existing situations, there'd be relatively steep rises in the insurance premiums that businesses would have to pay. So we're working to find a way to ease that, to smooth out so there's not a precipitous increase in the taxes that businesses will have to pay. And I believe we'll be successful on this. I can't give details today because we're finalizing this package, but we do think this is going to be answer to a significant concern and really help some businesses. The models we're looking at would achieve measurable rate relief in the hundreds of millions of dollars beginning in the 2021 tax year. So this is not a small measure, and I look forward to talking with you in the not too distant future about that. We'd also like to help our restaurants that now are moving so much to a takeout protocols. And we have seen tremendous creativity by our restaurants to provide nourishment and fun through the takeout mechanism. And we really want to help them do that. So one of the ways we've focused on is a way to reduce the cost they have when food is being delivered by delivery services. So I have used my statutory authority that I have to issue a proclamation that limits the fees that delivery services can pay to these hard-pressed restaurants. These services have made it possible for more Washingtonians to continue supporting local restaurants and enjoying their great food, and this is another way to help these local businesses. So we put a cap of 15% on delivery fees. It's very reasonable, and we think more restaurants will be able to cover their bottom lines as a result, and it's an 18% cap on all of the charges that you could make to a restaurant. So this is just another way to help the restaurant industry, and I think an important one given the rapid increase in the use of takeout services. I just want to strongly encourage everyone to help their local restaurants right now. Look, all of us share one thing in common. We have to eat and we like to eat. It's a really good way right now to help these restaurants by doing takeout business. And that can be done very, very safely if we dine with just our households. I just want to reiterate, we'd hate to have really good food from a good restaurant, have a takeout experience, and then have, 4 or 6 people around a table in someone's home infecting each other. That's not what we need. So let's help our restaurants, let's use takeout, and let's keep it in our households so we don't have more transmissions of this potentially fatal virus. This proclamation I made also prohibits delivery companies from shifting the difference in the costs onto their workers. Yesterday I sent a letter to our congressional leadership and the Trump administration urging them to immediately resume negotiations on a coronavirus relief package. The necessary measures that states are taking to mitigate this pandemic have created known hardship for businesses and families. People are struggling with job loss, with hunger, and with homelessness. Businesses are suffering as well, while Congress has not taken action this summer. And this is of great and growing concern because we are nearing a cliff of support from the federal government for Washingtonians. The PUA program for folks in the gig economy, the extended unemployment compensation benefits are going to run out at the end of this year. And we desperately need the Congress to reauthorize those programs, among many other things we need, including help the state and local governments. So the pandemic is accelerating, the federal assistance is going away, and the more time that is wasted, the more people that are going to suffer lasting impacts, both to their families and to our larger economy. We know the House of Representatives is willing to act. We need the President and the Senate to take their constitutional duties seriously as well and help solve this problem. We're doing everything we can at the state level. We know we're going to do more, but we need Congress to act as the ultimate big gun, if you will, in this effort. I want to mention local governments around the state. They've done an excellent job distributing this federal CARES money. They've received more than $1 billion in that fund, and I encourage them, obviously, to continue on this vein. because they need to use all these funds by the end of the year or they cannot use them. It's another deadline, another reason why we need the federal government to step up to the plate. I also want to address, if I can, our mental health, which is just as important as our physical health. This year obviously has been difficult for everyone. People are understandably traumatized and anxious about the situation we still are in. We know its impact on the holidays, making this even more emotionally telling on all of us. We know because of that, frankly, it's okay to not feel okay right now. It's a very natural feeling, but we want to make sure that people care for their health as we go through this. I encourage folks who have questions about that to check out the coronavirus.wa.gov with resources to help people for their mental health. It contains a number of mental health resources, including numbers where you can reach someone. There are national groups as well. The National Distress Helpline is on the screen, 800-985-5990, as well as programs we have in our state, which can provide non-clinical support and help people experiencing anxiety. Washingtonians can reach at 1-833-681-0211. So we do hope people will care for themselves and their loved ones and have hope. There is a reason for hope, because there's every reason to believe we're going to have a glorious, normal, fantastic, large family events next Thanksgiving. And this is something we want to have as many people who are alive next Thanksgiving as possible. So there is a reason for hope. We're very excited that a vaccine maker applied for emergency distribution plans today. There are others in the pipeline, and we are now developing our distribution system in the state of Washington so we can distribute an upcoming vaccine as quickly as possible. But we know we can all help individually during this holiday. This is a holiday where we want to give thanks for the people we love, and the best way to give thanks is to not infect them with this virus. And we are very hopeful that families are heeding our call to celebrate Thanksgiving in a safe way, which basically means with your household, and communicate and enjoy your relatives virtually and otherwise, because that's really the safest way to do this year. I'm not the only one who believes this. The Centers for Disease Control in the current administration themselves recommended that people not travel this Thanksgiving weekend, because not only are they traveling, but when they get home and they mix with people not in their household, that's just too dangerous this year. And we know this is a significant reason that this pandemic has taken off across the nation and certainly in our state. So I hope people will enjoy Thanksgiving in a safe way this year. I'm also concerned about testing. We want to make sure that people who actually have symptoms who can get tests. So we really do discourage people from getting testing just to enable them to have Thanksgiving dinner. It's just better to enjoy Thanksgiving in our own households, leave the testing capacity for those who really may be ill. We hope people can help out in that regard. So with that, I am happy to stand for questions.
Up first, we'll go to Rachel LaCour with AP. Go ahead, Rachel.
Hi, Governor. First, I just wanted to confirm that this increase, that this is all still covered by the Federal CARES Act. And then also, you've received letters this week from Democratic lawmakers, the Washington Hospitality Association, and the Association of Washington Business, all asking you to reconsider or modify these restrictions. Have you talked with those groups, and are you considering any changes before December 14th? And if not, why?
Yes. Could you bear with me just for a minute, Rachel? I wanted to get a document to share with you. Mike, could you help me just for a second here? If you'll excuse me just for a moment, because I wanted to get some info to you on my desk. Yes, this is CARES money, and it's a good way to use it, obviously. I'm glad we can do it because we can do it in a very timely fashion. And I think it has broad support as well. So we're very happy of being able to do this. Yes, I did have a conversation with some of the legislators who'd written me a letter yesterday. It was a really good conversation. I enjoyed it. People expressed their concern about folks in the restaurant business particularly, and I'm acutely aware of that. I share that view. I think all of us should understand how tough this is for restaurateurs right now. And we talked about that. And I basically shared with them the scientific data upon which we made this decision. And I guess there's 4 points that I can tell you that I shared with them. Number one, there's just a scientific certainty that the way this virus is transmitted is by people talking closely for prolonged periods inside without wearing masks. And this is restaurants. And no matter how good of a job a restaurateur can do, they can't eat with a mask on. So our restaurateurs have been doing, most of them, a good job trying to protect their employees and the like. But the scientific evidence is very, very clear from multiple research that this is a high-risk activity. The Infectious Disease Society of America calls it specifically a high-risk activity because this is an environment where you simply cannot prevent that transmission from occurring. So it's just a scientific fact that this is a place transmissions are at a high risk for it to occur. There's research demonstrating that. Research from Google has shown that people who go to restaurants or people who are positive for COVID go out to restaurants twice as much. Third, our outbreak data in our state shows that of the non-health related outbreaks we have had, the number one place is in restaurants. Let me repeat that. Of the outbreaks in our state that we have been able to track, the number one category is in restaurants. So we have international, national, and statewide data that shows that there's a high risk of transmission in a restaurant situation. And I think there's been some confusion because some folks have recognized that it's a small percentage of those we have confirmed of the total transmissions taking place in restaurants. But the reason for that is we don't track that information from diner to diner. We only track it from employee to employee. And it's simply impossible to really evaluate what percentage is coming. But we do know it's a high-risk activity. And I think the legislators, well, I know that they're pleased that we've been able to respond to help the restaurants through what we hope to be a temporary situation. And if we all abide by this, and if we dine safely at Thanksgiving, hopefully these will be short-term limitations for them. So I believe very strongly that this is the safe, reasonable, responsible measure to help the health of Washingtonians and eventually get our economy back on track. And you are seeing an increasing number of states and governors join me in this effort. And we have learned this as well, because we talked yesterday about the timing of this. One of the reasons we were successful keeping this COVID pandemic down to a relatively low level is because we acted early. And the clear evidence is days literally matter. Days matter about when you take these measures. So we've acted earlier than some states, not all of them. There's probably 5 or 6 or more that have this restriction now. But this early action is what really saves lives and prevents this from raging into an El Paso situation. So my conclusion is we're on the right track. And I'm glad, and I'm sure those legislators are glad, that we're now helping restaurants through these difficult times.
Do you want to ask a follow-up question?
Yeah, I guess I just want to ask about the social gathering aspect, though, because for months we had been hearing from you and health officials that social gatherings, picnics, whatnot, were really a main driver. So I guess my question is if cases continue to spike say 2 weeks after Thanksgiving, even with these restrictions on businesses in place, wouldn't that indicate that community spread through social gatherings is still primarily to blame?
Well, the issue of primary, we got to do this everywhere. It's not just the primary. I mean, if you have drunk driving and most of the drunk drivers are men, but only some are women, you still have to have rules to prevent this from happening. So any place, any environment that involves close breathing on one another is a dangerous environment. That certainly includes our households as well. So we need to act against all of our risky behavior and our risky environments, not just the ones that might be the highest percentage. That's kind of common sense. And right now it is risky beyond reasonableness to be in a restaurant. And it is risky beyond reasonableness to have dinner with people outside your household in your home. Both of those are too risky. And we have acted on both of those. The restriction that I posed prevented that risky behavior in restaurants. It also did in our households. So we have an all-comers approach to this. It's the only way we're going to be on top of this pandemic.
All right, up next, we'll go to Joe Sullivan with the Seattle Times. Go ahead, Joe.
Governor, you got a letter yesterday from the business group Challenge Seattle that urged sort of doubling down of the state's approach to navigate us better through this time here. And some of their points include, doing whatever possible to get K-5 schools, K-5 students back in class at the beginning of January, to expand contact tracing by a large amount and testing to better prepare people and keep them safe, as well as to better prepare and focus on a vaccine that's coming and provide more public data on hotspots, positivity rates in hotspots to help people respond. What's your response to that letter, and are you going to consider those measures?
Well, those measures all sound reasonable. I haven't looked at the letter specifically. I'm actually being briefed today on some of our improvements in the contact tracing program. We have some new ways that we think we can make it more efficient so we can reach more people more quickly. There is added contact tracing coming on capacity as well in King County and other places. You mentioned the schools. We have made recommendations to schools, including providing them information about the ability to safely open schools, which has happened in Washington State, and we've had that discussion with local school districts and other that has provided them that information that shows that you, in many cases, can open schools as long as certain hygiene measures are met. The vaccine distribution system, we still need some help from the federal government to clarify. We also have to know which vaccine will be distributed because, as you know, they're distributed in different ways. But as I said 2 days ago, we do believe that we have the capability to have a good, efficient, timely distribution system that will be available. And one of the reasons is one of the long poles in the tent, which is the refrigeration capacity. Our Department of Health has looked at this and believes that we will have adequate refrigeration capacity for the Pfizer product. There are still logistical issues to figure out the data handling issue to manage that data, and the department is working on that as well. So what I would say is all of those things to some degree sound reasonable, and all of them are things that we're moving in that direction. The most difficult thing is the schools issue, and we have deferred to local decision-making on this. And I just encourage everyone to take a look at the data on this to make decisions as we move forward.
Joe, did you want
Did I miss one of those in the letter, Joe? I think there was 4 things. I mentioned only 3, I think.
I think also public data, so the public can get a better sense of how these decisions are being made, especially with data and hotspots, such as test positivity rates that are a little more localized, hospitalization trends.
Well, we try to be as transparent as humanly possible. I try to think of any data we have in the Department of Health on much that's not on our website. I mean, I guess I will ask them what they're referring to, because I'm not sure what it is. We have the most comprehensive data I can imagine on. We have county by county breakdowns. We provide information even inside counties. We know that there is a disparity in King County of, we're getting to 14, 15, maybe 20% positivity in South King County. It's going up in North King County, but not as much. We have provided that information. I'll have to ask them what they're referring to. Lisa, is there anything you wanted to add to that on data? I don't know if Kathy's on the line.
Yes,
Kathy?
I guess I would say probably John could talk about the public health data. We'll say with respect to economic recovery data, please come and look at our economic recovery dashboard. And in addition to the traditional business and economic indicators, one of the things you'll find there is information about people accessing public programs as well.
Kathy, are you on the line?
John's on the line, John Weisman, Secretary of Health. So I would just add to what the governor said that really we've got a great amount of data on our websites, both the Department of Health website and coronavirus.wa.gov, including reports. And the point that, right now where we are is there's widespread community spread here. Folks everywhere need to be heeding, the governor's advice, the Centers for Disease Control advice, my advice. And honestly, I guess I would just like to say, really, we need everybody's help. Our healthcare workers need your help. Our educators who actually want to get those students back in school to be able to teach in the environments we know is most beneficial to kids want your help. Our elders who are, particularly at risk for some of the most serious consequences want your help. Our public health workers need your help. Our essential workers need your help so that they can stay safe. So we really need everybody pulling together because right now this is widespread. Almost every part of the state has rates that are really high, and that's requiring this kind of action. So please help us out.
Is in the contact tracing, we still have people that don't answer the phone, and it's really hard to do contact tracing if people will not respond. Yeah, we need to ask people to help out. We also need to ask people to do their own contact tracing, and that means that if you have a test, if you have any real concern, if you've got symptoms, you certainly have the right to call the friends you've been with in the last week and encourage them to get tested and to quarantine. We all have the ability to do that. And to some degree, we depend on citizens to help us in this regard by first answering the phone and themselves taking this on.
Am I the only one not hearing the governor?
Wi-Fi problems.
How we doing? John, can you hear me?
Now I can, yes, yep.
Okay. What I was saying is, I'm sorry if I'm going to repeat myself, but we need people to help out in the contact tracing. We can't do contact tracing if people won't answer the phone or their text message, and so we really ask people to help out. But what I was saying is that citizens can help in this regard too. If you are concerned about being positive, if you are positive, you certainly have the ability to contact the people you've been around and notify them that they need to be aware of this potential threat. And we're asking people to help in that regard as well. But most importantly, look, there is not enough contact tracing in the world to solve this problem if everybody has a giant turkey dinner this holiday. We're going to have a giant spike in December if we all enjoy turkey dinner the way we historically do. And that's just going to happen. So the most important thing we can do is encourage people, as my proclamation has done, to be safe this holiday season. And we'll have more to say about our changes in the contact tracing program. We're having a briefing in about an hour and a half on this subject. So we'll be able to talk more to you next time we're with you, Joe.
Did you want to ask a follow-up, Joe? It looks like it's trying to boot us.
I don't know if we're waiting for Joe or...
No, we're having some internet trouble.
To the extent anyone can hear me, we're having some difficulties here.
Okay. Can folks hear us now?
Yes, I can.
Okay, should we try another question?
Yeah. Okay, so let's go ahead. And go to Joe for your follow-up. Go ahead, Joe.
Hello, can you hear me now?
Yes, go ahead, Joe.
I wanted to ask about your, on Sunday, you urged people, if they're going to attend a Thanksgiving dinner, to quarantine and get a COVID test if possible. But in Seattle, they're reporting strained lines at the testing sites because of all the people trying to get tests. Are you still sticking with your message, or do you have concerns that that's going to max out testing for people that may have symptoms?
Yes, we do have those concerns, and that's why I'm encouraging people, look, don't get a test because you want to go to Thanksgiving dinner. Just put off that dinner until next year and do it virtually, because it has resulted in strains on the testing situation. So we would encourage people to find a way to enjoy Thanksgiving and not use up what is still a limited capacity on testing. Now, as you know, we still would hope the federal government would increase their assistance in increasing testing capacity. We could still use more help. We are getting some more antigen tests, but they are still limited to some degree as well. So yes, I am concerned, and people can help out this year by being safe and alive next year.
All right, up next, we'll go to Keith Eldridge with Como TV. Go ahead, Keith.
Governor, you were talking about the reasoning for the restaurants is because they take down their masks. How about bowling alleys and gyms? They don't necessarily have to take down a mask to throw a bowling ball down the alley. Why are you continuing to keep them closed?
Well, look, we have to reduce anything that has risk. And these things have risk. It is risky when people breathe hard in interior spaces. And that's what people do in gyms, to some degree bowling. And in bowling, they sit around close to each other in the little U-shaped thing and compare their score. And now, even if you're wearing masks, you're sitting there closely for some period of time. So there is risk involved in these situations. Gyms specifically have been called out as a high-risk environment I believe, by the Infectious Disease Society of America. So that's the reason for this. Now, I want to note that our restriction is much less than it was in March, too. In March, we had many, many more industries that were subject to our restriction, but somewhere you draw the line. We believe that we have prevented the highest risk environment, not all of the environments, because we wanted to keep our economy going. So we chose the things that have been identified as the highest risk environment, and there is risk even if you do wear a mask, particularly when you're breathing hard, particularly when you're physically close to people, and you really don't socially distance. And I can just tell you, there's just not a lot of social distance at the end of a bowling alley. So that's the logic.
All right, Keith, did you want to ask a follow-up?
Yeah, Governor,
If I may, just let me add something too, because it's important to share this with people. Look, these are tough decisions. I know they're subject to criticism, and I understand that. We have to understand that the house is on fire right now. We can't afford to just do a little bit and then 6 months from now, look how it's going. This state is on fire with the virus right now. It is raging. The acceleration curve is like 100% every 10 days. And when you are facing that type of fire, you have to take some actions, and you do the best we can to calibrate them to get the highest risk environments. That's what we have done. I am hopeful that we have put the calibration enough to at least flatten this curve. There's not absolute science that we are at that. And so what I'm saying is that given the extraordinary raging of this virus, we did not have the luxury of cutting this with a scalpel and taking months to decide where the right point was. We needed to act. And I believe this is a reasonable approach.
All right, Keith, would you like to ask a follow-up?
Yeah, Governor, any thought of following California's lead, Gavin Newsom, and putting in a curfew, 10 o'clock in California right now?
We have not had serious discussion about that. Obviously, you know, I can't eliminate anything, but we have not had any serious consideration of that.
All right, up next, we'll go to Laurel Demkovich with the Spokesman Review. Go ahead, Laurel.
Hi, this question is for the governor or Secretary Weisman. I'm wondering if you can talk a little bit more about the guidelines for social gatherings and the importance of both quarantining and testing beforehand, because there does seem to be a misconception that you can simply get a negative test and you'll be fine to go gather or go to Thanksgiving. So can you talk a little bit more about the importance of both of those?
John, do you want to address
So I
that?
think, sure. So this is John. So obviously, in terms of quarantining, if somebody's been in close contact with someone or you're not sure you have, quarantining for 14 days, which is the incubation period of this virus before one might develop symptoms, is a really prudent thing to do. And that's an option for folks to do that. But that means really staying home, no visitors, and in a strict quarantine, you wouldn't be going outside to get anything either and be with anybody else. You would literally be just with your household and nobody else in the household going out either. Those are some pretty strict sort of, protocols. I think, as the governor said, we are encouraging folks to postpone social gatherings this year. Only do that with folks who live inside your immediate household. Getting a test is not a guarantee that you're not infected. One can test for this and have been infected. And again, if you are within that 14-day window period, it's possible for your test to come out as being negative when you might be infected. Or for that matter, you may get a test on Monday, get the results on Wednesday, but have become infected from someone else if you haven't been, totally isolated away from others in that meantime. So again, we're asking people to, I think, do what is common sense here. And as the governor said, the house is on fire and we need everybody's cooperation.
We've talked a lot about Thanksgiving dinner for obvious reasons. But I think it's really important to realize that just can't be the limitation of our changes here. A couple of days ago, I said Russell Wilson would be back. I was right. He was 23 for 28 last night. And I was always confident of that. But I'm also confident that Washingtonians will celebrate by not infecting each other, watching the game, sitting on the couch, having a beverage. I mean, any of these household gatherings are very dangerous right now, and you can't test your way out of that. You simply need to change where and how we socialize, which is outside, even in this weather, under a porch with blankets, works really well. People ought to give it a try. But inside gatherings are just too dangerous.
Laurel, did you want to ask a follow-up question?
So multiple counties in the state have stopped contact tracing altogether due to a lack of resources. And I know you mentioned you'll be talking more about that later today. So can you just, talk, is that concerning to you? And is contact tracing even effective right now, given how many positive tests we're seeing?
You want to address that, John?
Sure, I'll take that. So the data and what I know is that some counties are doing exactly what we're going to be talking to the governor about today, which is focusing their case and contact tracing efforts. doing shortened interview forms and asking folks who are infected when they talk with them to notify people in their household and their close contacts and try and find out if any of those folks were at larger events that might be the super spreader events. So the ones that I'm aware of have not stopped their case and contact investigations, but rather are modifying them based on what we've learned over the last 8 months of doing this, and looking to where we can best apply our resources and get to the largest number of potential infections. So that's the information I have at this time, and that's the kind of thing we're going to be talking about with the governor this afternoon.
All right, up next, we'll go to Simone Del Rosario with Q13. Go ahead, Simone.
Hi, Governor. Thanks so much for the time. You already clarified that this is Federal CARES Act funds, so I have a quick question, then a follow-up for you. How much of our Federal CARES Act funding is left in the pot now?
I believe about $150 million, and we are considering the best usage for that. We obviously have multiple things we could invest. Making sure we have hospital capacity is important. Making sure we have nutrition for Washingtonians is important. So we're considering the remaining investment, and obviously we will make those decisions so we can get that spent before the end of the year.
Simone, did you want to ask a follow-up question?
Yes, thank you. I wanted to ask you about the restrictions and how equitable they really are in terms of spread. Dr. Lopi had shown us some data earlier this week that in a 15-person Thanksgiving dinner, there's an 18% chance that someone in that room would be infected with COVID and could spread it. But a church with up to 200 people, which is still within the limits allowed right now, there's an 80% chance that someone has COVID-19 in that room. So where do you draw the distinction? Because it doesn't seem like all of the risks are equal in what people can and can't do.
Yeah, it's an important question, and I wish there was a way to save thousands of lives and have everything perfectly equitable, but Einstein and Tesla and the Joint Chiefs of Staff could not come up with something that is totally equitable in this. But in regard to that specific question, one of the problems in households are people are eating, and when they're eating, they simply cannot eat with a mask on. We do have a requirement in religious observances that people wear masks, and that is a substantial reduction in the transmission risk. There is also the issue of constitutional rights of freedom of religion that we respect, and we have had quite good compliance from the faith community to comply with those restrictions. They're much more difficult to enforce in a household situation. So that was our rationale, and I hope that it is successful.
All right, up next, we'll go to May Huang with the Yakima Herald Republic. Go ahead, May.
Hi, Governor. Thanks for your time. It's really clear that a lot of, well, I don't know how many businesses, but a couple businesses, I guess, in the Valley in our region have been pretty public that they're probably going to defy the restrictions. And we've also heard that the YPD is telling people like not to call them if, businesses are open. So is there going to be any adjustments as far as enforcement?
What are those businesses?
Well, I mean, I'm not looking to rat anyone out, but I'm just saying that there are businesses that are, that have said on social media or, whisper networks. So.
Well, we will have enforcement activity. We do need businesses to comply. I do want to thank the vast majority of business leaders who have complied through these difficult days, and it has been the vast majority. When we have had a few folks that have not been willing to be responsible, we start by notifying them of the need to come in compliance, and we ask them to come in compliance. If they don't, then there are a variety of enforcement mechanisms that will be taken here, because it's not just the local law enforcement. There are licenses, business licenses, there are liquor licenses, there are injunctive relief if necessary, there are some fines that are appropriate. So there will be enforcement action if people are resistant to this obligation. We hope it's minimal. It has been minimal, again, because there's such broad acceptance of the need to save lives here. And most of the business people I talk to understand, look, if we're going to have a healthy economy, we can't have a raging pandemic. And we got to get through this so we can open up fully all of our businesses and get this behind us. And the thing is, we're close to this, relatively. We've got a vaccine on the way. I'm quite confident it's going to work. And so we just have to get through the next several months so we can restore all of our economy. And when I talk to business leaders, they get that. That's why we've had such high compliance of business leadership in this state. So we hope the enforcement is modest or minimal, but there will be enforcement. You will not be allowed to skate through this. This is the law of the state of Washington. I mean, there's been thousands of dollars of fines already in some of these non-compliant businesses.
All right. May, did you want to ask a follow-up?
Yes. I know a concern of some businesses is that, they say, hey, yeah, I know it's only 4 weeks, but hey, it might be longer. Do you have a sense of the potential that this could be extended?
Well, I obviously know that the more of us who are responsible in the next few weeks, the less likelihood that there would have to be some further restrictions. And I hope people will keep that in mind. We care about these business folks and their employees, by the way. It's not just the business owners. For every business owner, there's 20 or 200 employees that going to be out of work for a certain period of time. So the best way to care for them is to get through this and not allow this pandemic to continue. And I hope people are thinking about small businesses, as I have been, in multiple ways, one of which is to produce $135 million of assistance. The other is to encourage people to use takeout. And the other is to encourage people not to transmit this virus. That's the best thing we can do.
All right. Up next, we'll go to Hannah Scott with Cairo Radio. Go ahead, Hannah.
Hi, Governor. I'm wondering, I've heard from a few people who are concerned that the ban on indoor dining will actually end up leading to more people gathering at homes. I'm wondering if that was a consideration in coming up with that restriction and if it's being monitored at all right now.
Well, look, what we have done is we've looked at all the things we do in our society, and starting from the most risky to go down and advise and require people not to engage in the most risky behavior. And that's what we've done. The most risky behavior that I'm aware of in the state of Washington today is at a table dining with someone, which you have to do unmasked. And anywhere that happens, we have tried to reduce that. That includes in homes where we have issued a requirement that you not do that, and in restaurants, the same thing. So we have treated people the same, and that's the best that we can do right now. Now, obviously, our enforcement capability of that requirement is much greater in restaurants in a business than it is in a home. But we have created that legal requirement, and people who want to comply with the law, I hope they will comply for their own health and their loved ones. So that's the best answer I can give you, and I think it's the fairest thing we can do right now.
Hannah, did you want to ask a follow-up question?
Really quickly, just getting word from the Washington Food Industry Association, and maybe this is for Secretary Weissman too, that they are encouraging all of the shoppers to wear their masks. It sounds like they're having some issues and they're concerned about the essential worker safety of mask use there. And then also wondering if, Governor, you can speak to anything you've said to the casinos, understanding, of course, that you can't mandate anything there.
John, do you want to take the first question?
So I think, as I heard it, I mean, we're asking everybody to wear their face coverings when they're going to any business at this moment, whether that's for takeout, to-go kinds of services, curbside services, whatever. So I may have missed the question. It looks like maybe Nick wants to add in as well.
Yeah, I think I've worked really closely with the Washington Food Industry Association, and I know they've got a couple of businesses that are really struggling with some anti-facial covering protests happening at their businesses. And I know that can be a real struggle for some of those small grocers. And so we're doing everything we can to try to support them, and would just, again, ask everyone to please do the right thing and wear your facial covering, wash your hands, social distance, and we'll all get through this.
The question's for me. I've met with the tribal community recently as yesterday, encouraging as much hygiene as possible in all their operations. They have been, in many ways, very diligent in providing hygiene and separation throughout their operations, and we very much appreciated that, and we hope that that will continue. I do not have authority over those operations, as you indicated in your question, but I have encouraged them, and they have been, I think, quite diligent in many, many occasions, which I've expressed appreciation for. I wanted to add something about folks who have, some of your questions are good questions, and critiques. There's a lot of critiques of what we have proposed that are sincere and not illogical. But I do want to point out that that inaction is simply not an option here. And when I have talked to some folks who have critiques about this, I've asked them what they would propose to do to keep this pandemic from swallowing us whole. And frequently I don't hear an alternative. Look, inaction is just not an alternative here. And I very much respect people's critique of what we have proposed. But we have to do what is reasonable. We do have to take action. You can't beat something with nothing. Nothing is not the safe course here. And I think we've taken reasonable action. And I'm happy that we've ameliorated some of the difficulty by our actions today.
All right. Up next, we'll go to Melissa Santos with Crosscut. Go ahead, Melissa.
Hi there, Governor. I was wondering just, are there any restrictions that you mentioned or beyond what you mentioned about how businesses can use this $100 million in grants and loans? Like, for instance, can they use it to upgrade their outdoor dining space and stuff like that if they're a restaurant, or is it only for payroll and more and rent and those sorts of expenses?
Lisa, do you want to answer that? Lisa there? Lisa there?
Thank you for that question. This funding is very open-ended. We know that they have expenses that are COVID related, and we know they've got beyond payroll, they've got utilities and rent or mortgage payments. And so, no, it is not restricted.
Melissa, do you want to ask a follow-up question?
I do. One thing I was wondering, Governor, there is some new guidance from the Department of Health regarding ventilation and things like that for making indoor spaces safer that came out just in the last month. But sort of ventilation requirements and such haven't really been a part of the mandates for restaurants, when they were in the phase 2 entire period and stuff like that. I'm curious whether, if you had maybe talked more about ventilation as a public health concern and maybe using filtration and things like that, could we have prevented some of that indoor spread that has led us to where we are today?
Well, we have given advice to increase ventilation, but I have to tell you, we don't have the capacity to do a flow meter in all the thousands of square feet in restaurants across the state of Washington. So we have tried to give advice to the businesses that improving ventilation, improving filtration is clearly of benefit, but we simply do not have capacity to have state employees going into every restaurant and using a flow meter to adjust their ventilation. That's just beyond our capacity. So I think we've done what we can. I think a lot of businesses have been creative in this regard. And I want to tell you, I appreciate a lot of the business innovation that's gone on in so many different ways, including this. And I think there has been improvement. I believe we've done everything we can.
Up next, we will go to Natalie Swaby with King 5. Go ahead, Natalie.
Before we do, Nick, did you have any you wanted to add to that question? Nick has been working with the Restaurant Association very closely on all these matters.
I think you captured it really well, Governor. You know, we worked really closely with the Department of Health to put out those general guidelines and considerations for all businesses to think through how they do ventilation. It's really important. We definitely encourage any business to go out there and take a look at them. But ventilation alone, it's just a tool. We've still got to do all of those other things to try to de-risk those activities. But there's no perfect solution. It really takes all of those different elements.
Our staff, principally Nick, has been in constant contact with industries that we've affected here, and they've given us their advice, and they've given us their critiques. And I'm glad we remain in close communication with their leadership.
All right, I think we've got time for 2 more folks. So next we'll go to Natalie Swaby with King 5. Go ahead, Natalie. Natalie, are you there? All right, we'll go ahead and go next then to Essex Porter with Cairo 7. Go ahead, Essex.
Yes, I have a question for the governor and then a follow-up for Secretary Wiesman. Governor, I'm sure the rent assistance and the energy assistance will be welcome, but it won't be enough for many folks to get by if they have to stay home, even though they'd like to stay safe. In this next bit of money that you are able to direct from the CARES Act, is there any consideration to direct payments to individuals so that people can just stay home, feed their kids, pay their rent, and stay safe?
Well, we do have direct payment to individuals, and if I have something to do about it, we will continue through our unemployment insurance situation. That is a direct cash payment to individuals if you are unemployed. And we do want also to solve this problem of the PUA account, which is a federal benefit program, which is expiring at the end of the year. I believe we should find a way to replace that benefit if the federal government refuses or fails to act. Now, I can't guarantee that we can do that. Obviously, that'll take legislative assistance, so I can't guarantee it. But I do believe that we should replace that cash assistance program. Now, I've noted we have also provided, in some sense, in our rental, our moratorium on eviction for non-pay of a rent, and I'm glad we've done the cash assistance for the energy as well. So we do have, and I want to work to continue these cash assistance programs to people.
Essex, did you have a follow-up?
Yes, my follow-up is for Secretary Wiesman. Mr. Secretary, Dr. Jeff Duchin is saying that King County isn't getting the resources that he needs to plan for distributing the vaccine. What is the state doing to get King County and all the other counties the resources they need?
Right, well, thanks for that question. I think this goes back to a larger issue about some of the requests we have into the federal government for assisting with vaccine distribution. We're very appreciative that they are purchasing the vaccine for every person who wants it and are paying for the administration fees of that and certainly distributing it. But the bottom line is that we do need dollars as well to actually help local health and other entities with just getting the vaccine into people's arms. We do have some initial resources for that, so we are confident that in the very beginning of this, we will be able to respond, but this is going to need to be a long haul and something that we need resources for throughout a extended duration. So we and national associations are raising this issue with the federal government to see to it that they supplement the resources. For example, at some point, as we have more vaccine, we may need to be holding mass vaccination clinics and need to be able to have a workforce that we can deploy and pay for and facilities to set up. So those are some of the things that all of us around the country are indicating to the federal government that additional resources are needed. And that said, at the very moment, we are using the resources we have to develop our information systems, to enroll providers into the vaccine program, and to make sure that we are ready to go when the first doses arrive. But again, this is a long haul, and more resources are going to be needed.
Yeah, just a couple of comments, listening to the questions, good questions today. A couple things I hope we keep sight of. One, we ought to be filled with confidence and hope right now, even as dire this situation. We do have a pandemic that's burning across the state of Washington, but we know that how to beat this virus. This is in our hands. We control our own destiny. We decide whether or not this virus is going to kill a lot more people in our state. We make that decision. The virus doesn't make that decision. We make that decision. And when we made this decision in March, as difficult as it was, we beat this virus into the ground. It has come back with a vengeance. But we know we can beat it down again if we turn our mutual fates to be vigilant and resolute and dedicated to not allow people to die unnecessarily in the state of Washington. And so we ought to be filled not just with thanks this Thanksgiving, but thanks that we have control over this virus. It cannot move an inch unless we carry it. So when I approach this problem, it is with distress that I won't be able to have the typical large Inslee gathering that we have, but with confidence that by not doing that, we're going to save people's lives. And I tell you, that's something we're celebrating, and it's something to be worth to be thankful for. And I'm going to be thankful that my family this year has the ability to potentially save someone's life. And that's something that's really a blessing in my book. The second thing I would say is I ask people while we are considering these things, we've talked now for over an hour about the ramifications on some of our business folks. And those ramifications are very distressing to me when a restaurant owner, might be on the edge of survival and have these difficult decisions. Listen, that is something I carry. It's a weight that I carry, rightfully so. But don't forget what's on the other side of this occasion. Just a couple hours ago, I just saw a little squib about a 15-year-old that beat cancer and then lost her life to COVID. To the nurse who, for months now, has had the job of holding someone's hand when they were alone and couldn't talk to their relatives and their family in the last dying days. To all of these people who are having this profound suffering, let us not lose recognition of what we're up against here and the fruits of our labor. There are great fruits, and that's preventing people from dying these horrific deaths. Don't forget that. This is a noble pursuit that we are in. We've come a long ways. The goal line is in sight, and we ought to get there with as many team members as we can. Thank you.